Hi, everyone, and thanks for joining us. First up at 5 o'clock, possible changes are coming to the COVID-19 vaccine rollout here in our state. The Trump administration is recommending that states speed up delivery of these life-saving vaccinations.
Now, it's all part of a push to get people 65 and older vaccinated much sooner than before. Channel 3 Eyewitness News reporter Courtney Zeller has more right now on what this could mean for some age groups. Courtney?
Well, that's right. If you are 65 or older, or you're an adult with serious health conditions, you could be getting that vaccine sooner than you think. But there's one catch. The governor has to approve it. This group of allocation subcommittee members are discussing recommendations on who's next to get the COVID-19 vaccine in Connecticut. The group met virtually today and we listened in.
We definitely have to keep the federal recommendations in mind.
I would like to recommend today is that this committee consider recommending that individuals 65 and older be included in phase 1.
Most of these members want those 65 and older and adults with underlying health conditions added to the next vaccine group. They'll take their recommendations to the governor.
I am in favor of opening this up because I think that will cover, like we said, those who are the highest risk, will cover people who are sort of more vulnerable, as well as sort of, I think, addressing the racial and ethnic minority sort of concerns that we've been sort of talking about.
New guidelines set to be announced by Operation Warp Speed are expected to include adults 65 and older and adults of any age with underlying health conditions that put them at high risk. States aren't required to follow the guidelines. Many of these members, though, want to move on to the next phase of the vaccine program. Connecticut is currently in phase 1A, which includes healthcare workers, nursing home residents, and first responders. Currently in phase 1B, frontline workers, people in congregate settings, and those over 75 years old. These Connecticut members say their concerns are adding more people to the next phase and not having access to the vaccine.
Yes, I just don't want to give too many people too much of a false hope that the vaccine is going to be there for them tomorrow or next week, if we include this larger group.
We also should remember that we have an inventory in the state of Connecticut. While Connecticut does a great job in comparison to other states, we still have freezers full of vaccine that are waiting to be administered.
And on that last thought, as of yesterday morning, the government distributed 25.5 million doses to states, but only 9 million people have received that first shot. I'm sure much more to come on this in the days ahead. We'll keep you posted. For now, we're live at the mobile newsroom. Courtney Zeller, Channel 3 Eyewitness News.